specifically Streptococcus pyogenes. Important virulence factors are the exotoxins A, B, and C, which act like superantigens, leading to activation of large number of T cells that result in massive release of cytokines. What this basically means is that it causes an overly exaggerated immune response that is involved in the healing process. And that's where the symptoms are actually coming from. It's actually come from the immune response being overly activated. Okay. So the signs and symptoms are going to be similar to the staph toxic shock syndrome clinical manifestation, except that in this case, you would see a soft tissue infection where it's manifested with severe pain and tenderness to palpation wherever the trauma occurred. Okay. Okay, the next one is syphilis. Okay, so syphilis is considered a STD, a sexually transmitted disease. It's caused by a spirochete, which is a gram-negative spirochete bacteria. Gram-negative spirochete bacteria. This gram-negative, the spirochete bacteria actually does not have the lipopolysaccharide on or in its cell wall, which is unique because most gram-negative bacteria actually have the lipopolysaccharide in their cell walls. Okay. Okay. So what's the pathophysiology here? Okay. So first is that the spirochete invades the body through its virulence factors. Then within hours, it will spread systemically and binds to endothelial cells. Endothelial cells are the cells inside the blood vessels, okay? Leading to an inflammatory reaction which causes endartitis and perivascular inflammatory infiltrates, okay? And then there are 3 stages of syphilis that characterize its manifestation. Okay? Clinical manifestation. Okay? So let me write the name of the bacteria. It's Treponema pallidum. Okay? Okay, so the primary syphilis is marked by the primary lesion called a canker sore. This is a painless raised ulcer, ulcer that has an indurated borders and a smooth base. And here, right here, indurated ulcer and a smooth base. In about 6 weeks, this ulcer resolves. It can resolve without scar. Then, about 8 to 12 weeks after the primary infection, patients can get secondary syphilis. Okay? Secondary syphilis. This is characterized by constitutional symptoms. When you hear constitutional symptoms, that means fever, fatigue, headache, and muscle pain or myalgia. Okay? Now, the other thing, features that are specific, is this thing called condylomata lata. This is a specific wart-like papular rash. It's a broad-based wart-like papular. Papular means raised rash, most commonly found in the anogenital region, and sometimes in the back. You could see it right here. These are wart-like lesions. Wart-like lesions. Then you have latent syphilis. Here, most of the time, there is no really clinical symptoms. It's not characterized by clinical symptoms. Okay, where the disease can resolve in this case and during this stage, or it can reactivate, or it can progress to the next stage, which is tertiary syphilis. Now, what are unique clinical manifestations uniquely found in tertiary syphilis? Okay, first of all, destructive granulomatous bone lesions called coma. These are bone lesions. Okay, they can affect the aorta. They can cause aortic aneurysm. Aortic aneurysm. Okay. Another important manifestation of tertiary syphilis is neurosyphilis. And as a matter of fact, the famous German philosopher Friedrich Nietzsche actually died of neurosyphilis. Now, neurosyphilis is manifested either as personality changes or as hallucinations or as neurological manifestations. What a way to go for a brilliant guy. Yeah, he is a brilliant guy. I agree, Joshua. He's a genius. Yeah, he has an interesting philosophy. Um, okay, now gonorrhea. Gonorrhea. So let's talk about gonorrhea. First thing we need to know about gonorrhea is that gonorrhea is the second most commonly reported infectious disease in the US after chlamydia. Chlamydia is the number one most commonly reported infectious disease, not STD, infectious disease in the US. Chlamydia. Important risk factors for gonorrhea. First, it uses pili to adhere to the epithelial mucosa. It has IgA protease enzyme, which cleaves the immunoglobulin A in the mucosa lined tracts. Okay. Now, the organism that causes gonorrhea is called Neisseria gonorrhoeae, which is a gram-negative bacteria. And because it's gram-negative, like all gram-negatives, the cell wall has lipopolysaccharide.